Well, hey guys, welcome back. If you're new here, I'm Dr. Dray. I'm a board-certified dermatologist, and today we are talking about scabies. Scabies is a skin condition that many people have heard of, but is commonly misunderstood. Sometimes people hear the word scabies and they assume that this is simply a hygiene issue. It's not. Scabies is actually a relatively common skin infestation that affects millions of people worldwide every year. Anyone can get it. Today we're going to talk about what scabies is, how it's spread, what the rash looks like, and why the itching is so intense. Scabies is caused by a microscopic, tiny little mite called Scabies Scabii. The mite only lives on humans. So in other words, you can't catch this from like a dog or a cat. And the mites are so tiny, you're not going to see them with your naked eye. After a female mite reaches the skin, she burrows down into its outermost layer called the stratum corneum. Every day, as she's tunneling down deeper and deeper, she lays a few eggs. Within several days, the eggs hatch, and over the next few weeks, those larvae mature into adults. And the cycle repeats. Interestingly, it's not the mites themselves that are responsible for most of the itch. It's actually your immune system being like, what the heck is going on? It's this immune response that leads to that very intense and persistent itching. Now, one thing that comes as a surprise for many people is that symptoms don't start immediately. It usually takes about 4 to 6 weeks before your immune system gets sort of revved up and you begin to experience symptoms. So during this time, before symptom onset, it's actually pretty easy to end up spreading scabies to someone else. Now, if you've had scabies in the past and you get it again, guess what? Your immune system, it has a pretty good memory. Therefore, you'll develop the itch a lot faster, usually within a day or two after reinfestation. Scabies primarily spreads through prolonged skin-to-skin contact, like holding hands for an extended time, sharing a bed, sexual encounters, or just caring for another person. This is why scabies commonly spreads among family members, sexual partners, nursing home residents, dormitories, and childcare settings. Now, a common misconception is that you can catch scabies from inanimate objects like clothing, towels. You can't. You can't get it from a toilet seat or from touching furniture. For ordinary scabies, that's incredibly uncommon. The mites only survive a very limited time off of human skin. The exception, however, is something called crusted scabies, where the individual has like millions and millions of mites. And in those situations, then it is possible to spread it from contact with things. Scabies is one of those mimickers. It can look like a lot of things, and honestly, even the best of the brightest dermatologist has at one point in their career missed a case of scabies. It just doesn't always look like what people would expect. Usually you have these little small bumps, tiny little blisters, scratch marks, and then the skin can get crusty in areas where you're scratching a lot. Now, the classic distribution is very important. Scabies loves to appear in the web spaces between your fingers, your toes, also loves your wrists, your elbows, your armpits, the waistline, the buttocks, genital area, ankles, feet, and around your nipples. Now, adults usually don't develop scabies rashes on their face and scalp. However, infants, elderly individuals, people with compromised immune systems, they can have lesions on their face and scalp. But here is the telltale clue, the classic hallmark finding of, oh my gosh, we've got scabies, we've got to treat accordingly. And that is a burrow. A burrow is exactly what it sounds like, a tiny little winding path through the skin that the mite has made. This can be incredibly subtle. If you've ever seen a dermatologist before, they often have that handheld magnifying glass that is called a dermatoscope, and this is an excellent tool for allowing the visualization of these teeny tiny little burrows. Finding a burrow is incredibly helpful. It's considered one of the strongest clues that someone has scabies, and the burrows, you guessed it, they're often in between the fingers. Here's one of the things that perplexes people the most, and it's not just with scabies, but with itchy skin in general, and that is, why is it that the itch seems to get so intense at night? I mean, nearly everyone who has scabies ends up reporting this type of symptom where they can't sleep at night, they're up all night with the itching and scratching. Part of that relates to just our normal skin circadian rhythm. Our skin loses more moisture overnight, it has more blood flow to the surface, and those things rev up the itch signals and also lead to an increase in transepidermal water loss. And so that's one of the reasons why just in general, itchy skin becomes a lot worse at night. Not to mention, when you're lying quietly in bed, your mind is a lot more free, if you will, to wander and focus on things that you were ignoring all day. Most people afflicted with scabies only have about 10 to 15 mites on their body. Crusted scabies, which I mentioned earlier, however, is completely different. People with crusted scabies can have millions of scabies mites in their skin. This leads to the development of these thick, crusty plaques that often involve the hands and the feet. Again, those are common sites where scabies like likes to first hang out. The funny thing is, these patients may not itch very much. Their immune system typically is altered, and that's what allows for this to go to a point where it's quite burdensome. Crusted scabies is almost always going to be happening in somebody who has an impaired immune system or certain neurologic conditions. Because of the enormous burden of mites in the skin with crusted scabies, it's actually very contagious. I've seen many cases of crusted scabies in the hospital. Oftentimes these patients happen to be there in the ICU, may not be conscious, and therefore it can be very easy to miss. They're not verbalizing that they're itchy. They don't feel itchy either because they have, some neurologic issues going on or dementia. And so if you're not really thorough as a dermatologist seeing a patient in the hospital with the exam, you can miss this quite easily. I mean, as you can imagine, those thick crusted plaques, they can look like a lot of other skin conditions that patients in the hospital develop. Many cases are diagnosed simply though by looking at the skin, especially if you can find that little burrow. In my personal experience, I have found that the most fruitful, if you will, skin findings of the burrow are oftentimes you'll have this little teeny tiny itty bitty little clear colorless fluid filled blister. If you pop that with the head of a scalpel, then it will often reveal the little tunnel, and sometimes there's even a mite hanging out in there. In addition to examining the patient's skin, the history is going to be very important. Are there close contacts that are also really itchy? And usually what you're going to want to do as a dermatologist here is take a scraping of the skin. Remember, this mite burrows into the stratum corneum. If you've ever gone and gotten a pedicure, the technician will take that file to the callus on your feet. They're basically picking away stratum corneum. So we can pick away a little bit of that, and oftentimes there are mites embedded in that, and you can just take it and look at it under the microscope. You don't need fancy equipment. You don't need to order any expensive laboratory work. However, occasionally, especially in these hospitalized patients in the ICU, you might get a biopsy, and there are some very telltale findings in the skin biopsy under the microscope. That's where we actually take a piece of the skin out and we do this special processing and stains and all of that stuff. And yeah, you can see that mite hanging out there in the skin. It is like slam dunk. That's what it is. How do we go about treating this, however? Well, the first line treatment is typically a 5% permethrin cream, but you can't just apply the cream to areas of the body where you have a rash. Oh, no. And that's really important to understand, because one of the reasons why scabies can come back, if you will, is inadequate treatment. People often miss key areas like between the fingers, under the nails. As a side note, I don't know if I mentioned this earlier, but scabies will burrow up under your nails as well. You want to make sure you're putting the cream behind the ears, between the toes, all the little nooks and crannies. And this right here is super important, and failure to do this is a reason why treatment for scabies can easily fail and be a miss. You need to repeat the treatment in 1 week. Why? Well, the first application kills the mites. The second application kills the mites that hatched in the eggs. Some patients, especially those with a compromised immune systems, those with crusted scabies for sure, we actually bypass the permethrin cream and we go straight to the oral medication, ivermectin. This also might be recommended for patients who don't tolerate the topical permethrin because it is actually kind of irritating. Just applying the permethrin cream alone leaves patients itchy. It tends to be kind of irritating. By and large, the go-to regimen is permethrin and or oral ivermectin. Here are some of the biggest mistakes, though, that people make when it comes to dealing with their scabies and why they can be plagued with it for quite a while. The number one reason is that, yeah, you treated yourself, but you didn't treat your bedfellows, the people that you are closest to. Every close household contact needs to be treated at the same time, even if they're not itchy. Because again, remember, there's going to be a delay between the onset of infestation to the development of symptoms. Someone can be carrying scabies for weeks before they ever develop symptoms. But if only one person is treated, well, then the untreated contacts, guess what? They're going to repeat the cycle of violence over, and you're going to be plagued with reinfection. Admittedly, this is a diagnosis that freaks most people out. In fact, if you've made it to this point in the video, pat yourself on the back, because this is not for the squeamish. So fortunately, while you may be tempted to fumigate your entire home, you actually don't need to go through any rigorous disinfection protocols or anything of that sort. It is advised that you wash recent bedding, linens, your clothing that has come in contact with your skin. But again, remember, the mite really is not going to survive off of human skin. It's reasonable reasonable to vacuum up upholstered furniture, but again, it's very unlikely that you're going to get scabies from sitting on someone's couch. Now, probably the number one question that dermatologists get, and what keeps patients coming back even after they've been successfully treated, is the fact that this can leave you itchy for a long time. Some people cleverly refer to it as the 7-year itch. In other words, you can be successfully treated. That doesn't mean the itch will go away, because the mites are gone, but your immune system is what is like on overdrive here. It's still reacting to the proteins from the mites and the proteins that were released as the mites died with a treatment. In those situations, moisturizers with a topical anesthetic called pramoxine, cool showers, and topical steroids can definitely help buy you some symptomatic relief. Even a little antihistamine at nighttime, it makes you a little drowsy, a little sleepy. Doesn't directly address the itch per se, but can help with symptomatic relief. When should you see a doctor? If you develop an itchy, intense rash and other people in your family are, see a doctor. If you've been treated for scabies, yet the rash persists, I would see your doctor. You're going to want to follow up with your doctor, as a matter of fact, after you've been given a prescription for the permethrin cream, for example. If you think you or someone you're caring for, I should say, has crusted scabies, definitely let your doctor know. And then you're going to want to look for signs of what can also happen, a secondary skin infection. All this itching and scratching, you can introduce bacteria into the skin and you can get impetigo. Yeah, bacterial skin infection on top of a mite infestation. Sounds like a fun weekend, right? It is not. Usually you'll have pus, redness, skin tenderness. You might even develop a fever. Scabies is incredibly uncomfortable, very distressing to go through. It is quite a lot of suffering, but it's also highly treatable. The key to success with scabies is A, making sure the right diagnosis is given, B, making sure that you comply with the treatments appropriately and you use the treatments correctly, and C, all of your close contacts are also treated. And unfortunately, keeping in mind that the intense itching, it can last for several weeks, months, sometimes even years, long after the mites are gone. But most importantly, getting scabies is not a sign that you have a hygiene problem, but rather it reflects you had close contact with somebody who had scabies. All right, y'all, drop a comment down below. Have you ever heard of scabies? Have you ever dealt with it? Or do you know someone close who has had scabies? Let us know. But I hope you found today's video helpful. Now, if you want to know about other skin infestations, I have a ton of videos here on different skin infections and infestations, Demodex mites, bed bugs. Check out my YouTube playlist of skin signs of underlying health problems not to miss. You'll find a lot of these there. If you enjoyed today's video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.